It takes on all kinds of issues related to understanding narcissism, narcissistic relationships, and how to cope with them, heal from them, and just basically understand how these kinds of relationship dynamics affect all of us. However, for the month of May, we're taking on a different focus in the name of Mental Health Month, really breaking down in a very sort of basic way major mental health issues, but how they intersect with both narcissistic abuse and narcissism. This doesn't happen. These patterns don't happen in a vacuum. There are often other mental health issues that surround them. And today we're going to take on depression. Now, depression is something we call a mood disorder. And depression in and of itself affects nearly 300 million people worldwide, or a little bit more than 4% of the world's population. This is a significant sort of prevalence rate, speaking to how many people's lives are affected by depression, and by extension, their families, workplaces, etc. Now, interestingly too, rates of depression are the highest in younger people who are between the ages of 18 and 25. Now, when we are talking about depression, we are usually talking about something we call major depressive disorder. And that has a specific architecture to it. That's probably the most sort of severe way that depressive symptoms can look. But there are other related sort of depressive disorders out there. And those include things like persistent depressive disorder, which may be a lesser intensity of symptoms, but that lasts for a much, much longer time. And also things like seasonal affective disorder, which is a depression that's very much linked to sort of light cycles. So people who in the wintertime at higher latitudes, the people like Canada, Alaska, Scandinavia, people in those regions not getting as much light, there's a greater likelihood of some people being at risk for depressive symptoms due to those patterns. When we think about any mental disorder, we can think about how the symptoms present in sort of like 4 areas. Emotionally, how a person's emotions are; cognitively, how they think about it; physiologically, how it affects things like maybe sleep or appetite; and behaviorally. We know that in depression, the prominent thing that we see in terms of emotions is sadness. But we can also see mood states or emotional states like irritability, or just a loss of pleasure in things that would ordinarily give a person pleasure. From a cognitive or thinking perspective, depression is associated with a change in how people think about the world, about themselves, about the future. It tends to be people who are depressed tend to view the world as sort of forever going to be bad, and the future is always going to be terrible, and things are always going to go poorly for them. And with that kind of what we call an attribution bias, in many ways, sadly, the world often delivers, or the person who's depressed selectively pulls out the evidence that supports that way of thinking, which, as you can imagine, keeps those emotions down too. Physiologically, depression is very much about changes in appetite, changes in sleep, a person having far less energy than usual, feeling more fatigued or lethargic or apathetic. And behaviorally, people who are depressed are less likely to engage in activities that would, again, usually give them pleasure, or just less likely to engage, and may isolate themselves from friendships, social relationships. It may affect their engagement at work, engagement at school, engagement in caregiving. So you basically see behavioral changes where, more often than not, people who are depressed increasingly withdraw from the world. So let's diagnostically talk about what depression looks like. A major depressive episode is characterized by having symptoms of depression for at least 2 weeks, almost every day, and it can go on for much, much longer than that. In fact, the average depressive episode can last 3-4 months, even if it's treated, and if it's not treated, it can go on more than 6-12 months. So these can last a long time. And if any of you have ever been depressed, even feeling like that way for 2 weeks is really, really quite overwhelming. So in order to be diagnosed with depression, you have to have the symptoms for 2 weeks. And the symptoms include things like having a depressed mood most of the day, nearly every day. And either the person says that they feel depressed, like say literally, I feel sad, I feel hopeless, or other people notice it in them. Like say, this person's tearful, they're withdrawn, they clearly have cut out from the world, they seem sad. We look at people who also have something we call anhedonia. And anhedonia is losing pleasure in activities that typically bring pleasure. Mood symptoms in depression can also look like irritability. Now, other things we will see in a person who's depressed is that you'll see changes in weight. Either people will gain weight or lose weight, and that's usually due to a change in appetite. We will see in changes in sleep. Either people can't sleep or they sleep too much, and typically that sleep cycle will be thrown off, going to bed very, 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 very late after everyone's gone to sleep, and then sleeping until like noon or 1 o'clock. People who are depressed can often feel somewhat restless. They can't quite sit still. They're not quite comfortable, or they slow down in how they move through the world. Lots of fatigue, loss of energy. People who are depressed often feel worthless. They feel guilty, and they can feel hopeless. And that can cut through their days most of the day, and they'll feel guilty for not even having done anything wrong. People who are depressed also have problems with concentration, with thinking, and there's also a lot of indecisiveness we will observe in people with depression. People who are depressed are also prone to having thoughts of death, and that can be manifested as just thinking about that death, having recurrent suicidal thoughts, and maybe even making suicide attempts or even having a suicidal plan. And these symptoms of depression have to be at a level that they're causing real problems for a person's life, their relationships, their work, their ability to take care of themselves or other people, school, that sort of thing. Now, let's now take this to talking about narcissistic abuse and depression. The symptoms we see in depression: sadness, the not getting pleasure out of activities you usually get pleasure from, problems with sleep, fatigue, worthlessness, self-blame, problems with concentration, helplessness, hopelessness, indecisiveness. A lot of those are the central patterns that we see in narcissistic abuse. In people with narcissistic abuse, let's say a person's going through narcissistic abuse. In those who don't have depression going along with it, but they have all these symptoms because of the narcissistic abuse, they're sad and indecisive and fatigued and feel worthless, we'll often see a clearing of the symptoms that look sort of depressive as these issues around the narcissistic relationship get addressed. Either the person leaves the relationship, or they now finally understand the relationship, or they give themselves permission to set boundaries, or whatever, however it is they're making sense of the narcissistic abuse. They will, you'll see that these depressive symptoms will raise. And again, most commonly, when a person leaves a relationship, they'll see more of the clearing of the symptoms, or at least has really, really clear boundaries. However, what we've got to remember is that people who are experiencing narcissistic abuse may also have depression co-occurring next to those symptoms of narcissistic abuse. So not only does a person have depression, now they may also be experiencing a narcissistically, difficult, abusive relationship, and the two together really, really become sort of not only an incredible challenge for the person experiencing it, but also sort of a challenge for how it'll be addressed in therapy. And it can very well be that the issues that came up in the relationship are enough to induce a full-blown depressive episode, or the person may have had a history of depression before they ever got into a relationship. And the challenge of that is, for a person who's depressed to be in a narcissistically abusive relationship is actually really, really challenging, because they're already feeling worthless and they're already feeling diminished, and the relationship is just adding to that invalidation. So it can actually be a really, really toxic combination. Now, in narcissistic abuse, these patterns, that parallel depression, the symptoms we see in narcissistic abuse, similar to those in depression, they often come up because of the stress and confusion of the gaslighted narcissistic relationship. And many people who are experiencing narcissistic abuse, because it's so confusing, and a lot of people out there don't understand this, they often become very isolated because there can be a lot of shame. People in these relationships will blame themselves. They feel like, I should be the one who should be able to fix this. And they feel like there's nowhere to turn. Sometimes they even can't find a therapist who fully understands it. So when people who are experiencing narcissistic abuse, for example, might turn to therapy, because so many of the symptoms are similar to depression, it's very, very possible a person experiencing narcissistic abuse will get a diagnosis of depression. Okay? And then what happens then is that they're treated almost exclusively for depression. They might get medications, they might get the kinds of therapies that work for depression, and that's great. but that it still may not cut to the core of the issues in the narcissistically abusive relationship. So now maybe they'll have an uplift in mood, but that may not have been the issue. That all the confusion and the indecisiveness is really a byproduct of the difficult relationship or relationships. So the challenge is that a lot of people who are experiencing narcissistic abuse will turn to therapy, and then when they're in therapy, they'll be told like, oh, you're having problems in your relationship? Well, you need to just learn new ways to communicate in this relationship. And because no form of communication is going to work in a narcissistic relationship, that takes the existing themes of helplessness, hopelessness, and self-blame, and now it gets even worse. So you can see how this really all does get confused. The pictures of narcissistic abuse, a person experiencing these patterns, and depression. And so that's why people who are experiencing both patterns need to be addressed, depression and narcissistic abuse, separately. For the clinicians out there who might be working with clients going through this, if a person's experiencing depression in addition to narcissistic abuse, it's important that the client be treated, obviously, for both issues in parallel, but that the depression should not be used as an excuse for what is happening in their adult narcissistic relationship. And nor should their depression ever be used as a way to explain away the sort of negative thoughts a person is having about their family of origin or their other relationships. So for example, a person's like, oh my gosh, I'm never going to make this relationship work, or I don't know how I'm ever going to get through to my mother or father or whatever. You can see how a therapist says, oh, you're depressed. You're seeing everything like this. It's possible, but it's also quite likely that these relationships are so toxic and difficult that that's actually a moment of clarity. So the depression shouldn't be used as almost like a way to sort of say, oh, you're just thinking these negative thoughts because you're depressed, rather than this is actually an unhealthy relationship. To work with clients with narcissistic abuse is actually to be quite holistic. Now, let's take a turn and talk about, though, how narcissism and depression are related, because they really are. People who have narcissistic personalities often have co-occurring depressive symptoms, which is interesting because we also see that in the people experiencing narcissistic abuse. When we traditionally look at narcissism, we focus on things like the acting out, the grandiose and manipulative behaviors. But this is a personality style that's actually characterized by a lot of internal distress. It's not a comfortable pattern, especially when a person who's narcissistic has their vulnerability or their shame activated. In a person who's narcissistic, you'll see a fear of abandonment, a fear of losing narcissistic supply, anxiety about relationships and how they're viewed in the world, fears about being inadequate. So narcissistic people also have self-esteem that fluctuates actually quite wildly depending on what's happening in their world. If people think they're great, then they have the best self-esteem in the world. When they're having a day when they don't get enough supply, their self-esteem bottoms out. And you might be thinking, isn't that all of us? And actually, no, it's not. For a healthy person, self-esteem is stable. So you're like, I'm a good person. I had a bad day at work, or this may not be the right job for me, or I had a fight with my partner, but I'm still me, I'm good, and I'll figure it out. But for a person with depression, they'll go from I'm the ruler of the world to nothing ever goes my way. And that jumping from grandiosity to despair, you can see how that could actually be very unsettling, not only for a person who is narcissistic, but for the people around them. So when they can stay grandiose, everything's good, but when they can't, things go south. This whole pattern is actually what the researcher Elsa Roningstam, who writes extensively and beautifully about narcissism, she's identified this pattern, and other people have also called this. When we see this, the people who have these big crashes and feel very vulnerable, it's what we call covert or vulnerable narcissism. That greater sense of victimization and the sort of this angry, resentful, sullen entitlement. As Roningstam and her colleagues have pointed out, depression emerges in a narcissistic person when their narcissistic defenses fail. And what are the narcissistic defenses? Grandiosity, arrogance, entitlement, all the stuff that sort of puffs them up and protects them from that sense of insecurity and inadequacy. For people who are narcissistic, some theoreticians believe that depression for them is when they're raging at themselves. So they get so angry at themselves for being inadequate, for not being perfect, that that's how depression manifests. For those of us and those of you watching who may be therapists, clinicians, or anybody working with narcissistic clients, many times when we're seeing it's that vulnerable part of the narcissism and the associated sort of depressive symptoms. So the person's a vulnerable narcissist. They're angry at the world. Nothing's going their way. They feel like nothing's fair. Maybe that also means their marriage is on the rocks, or their job or professional life is falling apart. That discomfort is often what could bring a narcissistic person into therapy, and it's often misdiagnosed as only being depression, and the narcissistic symptoms have been missed. And my experience with this has been that the depression in a narcissistic person has a very victimized feel. And if only things had gone my way, if only things could be what I want, if only. And there's also a very entitled, why can't I have my way? I deserve so much. I deserve things to go my way. I deserve a parade. I deserve a promotion. I deserve. That entitlement and that victimization is very much how this sort of narcissistic depressive mix tends to present in a therapy setting. Now, this can actually be very confusing for people in relationships with narcissistic people, because they'll say, gosh, my partner's just really depressed, create the dissonance. They're being irritable because they're depressed. I just should be nicer to them. And so then people say, this is my fault, or I'm not trying hard enough, or I need to meet them where they're at. It raises a lot of pity. It raises a lot of concern. And then when a person, and here's an interesting test, if you're with somebody who has both depression and narcissism, and you reach into them and say, hey, I can see you're going through a lot, and it's okay, we all have weak moments. In that situation, the narcissist will rage at the person, and that will devastate the person who's being kind to them, saying, oh my gosh, I was just letting them know, like, I'm here, I've got their back. Why are they so angry at me? Why? Because you pointed out the vulnerability. You pointed out that sense of almost what they view as inadequacy, even though it's not. But when that gets activated, it's really destabilizing, and boom, it's reacted with rage rather than a thank you for being there, thank you for supporting me. So much as when a person's living with narcissistic abuse, if a person who has a narcissistic personality is also showing depressive symptoms, it needs to be addressed by addressing the narcissistic patterns and vulnerability. It's very tempting for any clinician to say, oh, we've got to focus on the depression. And addressing the depression is important. But in a person who's narcissistic, just addressing the depression is never going to be enough. And for the clinicians out there, you've also got to address the narcissistic patterns. And that's actually the really hard piece of this. You can put a person on antidepressants and their mood may lift. Now their mood has lifted and they're still really angry and victimized and entitled. So you haven't removed that original conflict. Now, as with any of these videos, I am going to make clear that this is just informational. And so if you are experiencing depressive symptoms, whether you're going through narcissistic abuse, whether you're experiencing symptoms of or patterns of narcissistic personality yourself, it's really important, very critically important, you work with a licensed mental health practitioner to get therapy, or even consult with your primary care provider for a referral. We've also put some resources in the video notes here, so you can also check out those links to get more information about depression, treatment, options, and assessment. So I hope this has given you some clarity on how depression and narcissistic abuse, as well as narcissism, interact. As you can see, it's actually a relatively complex relationship that not only people experiencing it struggle with, but even clinicians aren't always so sure. So if you have any thoughts or comments on this, please, as always, drop them in the comments section. Would love to hear your thoughts. Thanks again.